Hello everyone, I'm Ferry Tomaszyk, International Sales Manager and RehaCom Consultant with HASOMED GmbH, Germany. I want to welcome you to this recorded RehaCom presentation. The presentation focuses on the remediation of attention, processing speed and working memory deficits in neurological and psychiatric conditions with RehaCom. 5 main topics are on the agenda. Today I'd like to give you a short introduction to the foundations of attention, information processing speed and working memory, and we will review deficits in neurological and psychiatric conditions. In today's lecture you will also learn more about RehaCom's structure and course of attention and working memory therapy. Then I will show you as an example the therapy modules attention and concentration and working memory in 2 short videos. Finally, let's take a look at the therapy results report. Rehabilitation of impaired cognitive functions is considered as a standard component of medical care after acquired brain injury. Evidence supports the effectiveness of the 2 major categories of techniques, the traditional one and computer-aided ones, which are widely used in cognitive rehabilitative treatment. Moreover, there's an increasing awareness of the seriousness of cognitive dysfunctions in psychiatric disorders and the need to improve cognition. Cognitive deficits in psychiatric disorders ranging from decreased attention and working memory to disrupted social cognition and language. Computer-aided cognitive remediation therapy was found to improve and correct cognitive performance and real-life functioning. Attention and working memory disorders are very common in both neurological and psychiatric patients and affect all areas of life. There's a broad agreement in science that working memory is closely related to attention. Attention allows information to be taken in. Working memory helps the brain make sense of it. Attention and working memory are both key to learning new information. Attention training is based on the premise that attentional abilities can be improved by activating particular aspects of attention through intensive repetitive exercises. The repeated stimulation of attentional systems via graded attention exercises facilitates changes in attentional functioning. RehaCom's attention battery is designed to isolate and discreetly target the subdomains of attention with training exercises. The aspects of attention that are trained I'd like to introduce today. Attention is a multidimensional cognitive function, and RehaCom enables with 3 modules to train and enhance the ability to stay alert, the alertness, and the abilities to maintain focus and level of attention, called vigilance and sustained attention. These abilities are responsible how the brain is able to provide and keep attention. RehaCom's attention battery includes 5 graded structured exercises to improve cognitive deficits in focused attention, selective attention, and divided attention. They are characterized by filtering processes, the selectivity. Focused attention is the ability to actively focus on one thing without being distracted by other stimuli, and selective attention allows focusing on a specific stimulus while ignoring other competing or distracting stimuli. Divided attention, as the most complex variant of selectivity, refers to the ability to respond to 2 or more events or stimuli simultaneously. Alternating attention, the ability to change quickly and flexibly the focus of attention and switch between different events or tasks, can be trained with at least 3 to 4 modules. Visual spatial attention is essential for visual perception and performance. RehaCom offers a number of comprehensive exercises that range from visual spatial perception to visual constructive skills. Working memory is characterized by mechanisms and processes that hold information currently most needed for an ongoing cognitive task available for processing. This process is a critical and limiting factor for cognitive control and executive functions. RehaCom's working memory training is divided into 3 different submodules. Each submodule offers tasks that target the storage system, selective attention, and the central executive. The module working memory supports both the storage and the manipulation components of working memory and increasingly involves selective attention and inhibitory processes at the same time. The functionality of the working memory provides a basis for many higher cognitive functions such as problem solving, speech comprehension, arithmetic, and intelligence achievements. Let's spend a few minutes to take a look at the implications of attention and working memory deficits in neurological and psychiatric conditions. Cognitive impairments are commonly encountered in neurological rehabilitation. Almost any brain injury can result in impairment of attention and working memory. RehaCom promotes remediation and improves patients' outcome post-stroke and post-traumatic brain injury. Disorders of attention and working memory are among the most common neuropsychological impairments after an acquired brain injury. Significant improvements have been demonstrated in numerous studies and systematic reviews of the literature. Evidence suggests also that cognitive rehabilitation is effective in MS-related cognitive dysfunction and may confer long-lasting effects. More than 14 studies have already proven the efficacy of RehaCom in relapsing remitting MS. A randomized sham-controlled trial by Lambros-Messines et al. 2020 provide the first evidence supporting the efficacy of a home-based computer-assisted cognitive rehabilitation with RehaCom in secondary progressive multiple sclerosis. Since the onset of COVID-19, there has been emerging evidence that some recovering from this illness are experiencing residual cognitive impairment. Caused by inflammation or stroke, a relevant proportion of patients show deficits. Rehabilitation is crucial for restoring the cognitive abilities of those affected by COVID-19. The effects of computerized cognitive training in older adults with mild cognitive impairment or dementia are reviewed in a systematic review and meta-analysis in the American Journal of Psychiatry 2017 by Hill and T et al. Small to moderate effects were found for global cognition, attention, working memory, learning and memory, with the exception of nonverbal memory and for psychological functioning, including depressive symptoms. A placebo double-blinded evaluation with 60 healthy older adults published in Front Aging Neuropsych 2018 by Weicker et al. Concludes working memory training with RehaCom is an appropriate and efficient intervention specifically targeting the working memory system. In summary, attention and working memory deficits are an important target for efforts in cognitive rehabilitation, particularly in stroke, traumatic brain injury, multiple sclerosis, lingering effects of neuro-COVID-19, and partially in geriatrics. There is an increasing awareness of the seriousness of cognitive dysfunction in psychiatric disorders, and the need to improve cognition. Cognitive deficits are a driver of functional impairment with impacts across the spectrum of major psychiatric disorders. Cognitive deficits in psychiatric disorders ranging from decreased attention and working memory to disrupted social cognition and language. Computer-aided cognitive remediation therapy was found to improve and correct cognitive performance and real-life functioning. Psychiatric disorders are associated with complex and disease-specific patterns of cognitive impairment. Disruption of cognition is provoked and countered by various interacting genetic, epigenetic, developmental, and environmental factors. Certain cognitive impairments can be improved, rectified, or compensated, so treatment is crucial. A brief overview of the main characteristics of cognitive impairment in psychiatric disorders are shown in this table. Multiple domains are usually affected, inclusive attention, vigilance, information processing speed, working memory, episodic, semantic, verbal and visual memory, executive functions, social cognition, language, fear extinction, and more rarely procedural memory. Depending on the specific psychiatric disorder, cognitive deficits ranging from consistently present but not pronounced over a common marked characteristic up to a core severe universal characteristic of the disorder. As you know already, science distinguishes between various attention subfunctions. RehaCom delivers 13 specific attention modules and 1 working memory therapy module. Depending on the disease or damage localization in the brain, different attention functions can be affected and require specific, intensive, and hierarchically organized treatment. So the treatment may start with attention activation and maintenance trainings, followed by focus and selectivity exercises, trainings of the information processing speed and flexibility, multitasking, visual spatial performance, and mental control. As introduced in the previous presentation, recommendations are given by RehaCom's screening battery. The screenings are supposed to assist the therapist to find the right therapy modules. As a result, the screenings recommend therapy modules most suitable for treating the client's specific cognitive deficits. However, most therapists start the attention therapy using the RehaCom module Attention and Concentration. This training module many patients can handle easily in lower levels of difficulty. The idea is a resource-oriented approach and mostly guarantees a motivating, smooth kickoff. The following short video will show how this module works.
The RehaCom training module, Attention and Concentration, trains selective attention. When focusing on a target-oriented action, this function is needed for differentiating important from unimportant things. Therefore, relevant stimuli can be processed, whilst all others will be suppressed. Training with this module is indicated for patients with neurological diseases such as stroke, traumatic brain injury, brain tumour, morbus Parkinson's, and multiple sclerosis, as well as for patients with psychiatric, gerontopsychiatric, and other diseases such as depression, schizophrenia, early dementia diseases, addiction diseases, and attention impairments in child and adulthood. It is important to start therapy immediately after the according diagnosis. Before starting the training module, it is possible to individualize the training parameters. Via the therapist menu, one can adjust the level of difficulty, duration of session, instructions, help, or stressors according to the patient's needs. It is possible to change these parameters at any time during the training. In this module, the task is to find the correct object, in a set of presented objects in a matrix. The reference object is shown at the side of the screen. Only one object in the matrix is identical to it. Depending on the impairment, it is possible to switch the position of the matrix and the reference object. The training begins with a low number of objects which are easy to differentiate. With rising difficulty, there will be a greater number of objects with increasing complexity. RehaCom works auto-adaptively. The difficulty level will rise or fall depending on the patient's performance. The performance bar illustrates this development. With each change in level, the user will receive additional feedback. At the end of a training session, RehaCom will create an evaluation graph. Training results will always be saved automatically. The patient will then continue from this stage when starting the next training session.
Basically, the starting point can be mostly attention and concentration, but each patient has his own specific cognitive deficit profile, and it should be worked on its individual deficits, which may require a different starting point in the hierarchy. If attention and concentration is too hard, the better starting point could be the module alertness, as you see here at first on the slide. The alertness module supports the attention activation and trains the intrinsic and phasic alertness. Alertness is the most basic subfunction of attention, followed by vigilance and/or sustained attention. RehaCom reinforces, strengthens, or restores impaired attention skills. Proven principles of neuroplasticity are the foundation and a driver of RehaCom's effectiveness in attention and working memory deficits remediation. Training starts at a basic level and moves on to higher level attention skills. If your patient is steadily progressing using the module attention and concentration, what means reaching higher levels of difficulty smoothly, you can add or switch to modules recommended by the screenings in order to continue with a deficit-oriented approach. Then you can supplement or replace stepwise modules recommended by the attention screenings, or you follow the hierarchically organized order you see on the slides, and continue with the module reaction behavior followed by responsiveness and working memory. The module reaction behavior aims to improve reaction speed, accuracy, and inhibition to visual stimuli. The training of the reaction behavior is close to reality by using thematically related objects as signals, for example traffic signs, animals in the meadow, etc. When certain objects appear on the screen, a specific button on the patient keyboard must be pressed as quickly as possible. There are also irrelevant signals, which should not be reacted to. The meaning of the objects is usually associated with the reaction button in order to minimize the memory components. The responsiveness training module uses simple tasks, simple choice and multiple choice reaction tasks for training a patient's reaction speed and accuracy. The training contains both visual and acoustic stimuli. After the appearance of a defined visual stimulus or the presentation of an acoustic stimulus, the patient is supposed to press a corresponding button on the RehaCom keyboard as quickly as possible. In higher levels, irrelevant pictures are presented too, so inhibition will be trained as well. This module is more challenging than the module reaction behavior. Here the pictures do not correspond always to the reaction buttons. For example, the picture shows a cross, but the patient has to press an arrow button. So, cognitive flexibility will be trained too. In both modules, the interstimulus interval will decrease stepwise. In lower levels, the patient determines the processing speed. A new stimulus appears after the reaction, but a stochastic time passes. In moderate levels, the stimuli appear in a pre-established time period. In higher levels, stimuli appear adaptively. The time decreases after correct reactions and increases after incorrect reactions. The next module aims to improve the working memory domain. This sophisticated training consists of 3 hierarchically ordered modules that are designed to exercise the main components of working memory on the basis of a card game. This module trains the storage system, the maintenance of information, the selective attention, memorizing selective parts of information and inhibiting others, and the central executive, the manipulation processes. Before we continue, it's worth noting that all given recommendations in this presentation according approach and course of treatment are driven by theory and clinical experience, which may differ from your clinical practice. Please follow your own experience and approach. However, the system offers a comprehensive toolbox even for patients with severe, moderate or mild deficits in all stages of rehabilitation. Moreover, all RehaCom modules are self-adaptive. They measure the current performance of the client during the course of therapy and automatically switches to the according level of difficulty. This forces neuroplasticity and guarantees an optimal outcome. The following short video will show how the working memory module works.
The RehaCom module, Working Memory, trains functions of the working memory. It is responsible for storing and manipulating information for short-term use. Working memory is the basis for many higher cognitive functions, such as problem-solving, speech comprehension, calculations, and intelligence capacities. It is also responsible for storing what has been learned before. Training with this module is indicated for patients with neurological diseases such as stroke, traumatic brain injury, brain tumour mainly in the frontal lobe, and multiple sclerosis, as well as for patients with psychiatric, gerontopsychiatric and other diseases such as depression, schizophrenia, addiction diseases, and attention impairments in child and adulthood. Before starting the training module, it is possible to individualize the training parameters. Via the therapist menu, one can adjust the level of difficulty, duration of session, instructions, and help or stressors according to the patient's needs. It is possible to change these parameters at any time during the training. The task in this module is to learn and train strategies as well as to memorize, keep, and manipulate information. In this case, the stimuli are represented by a deck of cards. In the memorizing phase, playing cards will be presented one after another. Those cards then have to be recognized and selected from the bottom row of cards to be placed on a table. The first training level starts with 3 cards which have to be recognized. With rising difficulty, the cards themselves become more complicated. Then, the cards should be presented on the table in reverse order. During further training, the number of cards to be memorized and manipulated will rise to a maximum of 8. High-performance patients can optionally train further functions of working memory, such as resistance to interference. RehaCom works auto-adaptively. The difficulty level will rise or fall depending on the patient's performance. The performance bar illustrates this development. With each change in level, the user will receive additional feedback. At the end of a training session, RehaCom will create an evaluation graph. Training results will always be saved automatically, and the patient will continue from this stage when starting the next training session.
Visual spatial abilities are essential in everyday life, from navigation, understanding or estimating distance and measurement, and performing on a job. RehaCom offers a number of exercises that range from visual spatial perception to visual constructive skills, including 2- and 3-dimensional visualizations. As an example, I will introduce you to the approach and features of the module Spatial Operations 2. With this module, basic functions of visual spatial tasks can be trained in the following categories: position estimation, angle estimation, fill level estimation, one-dimensional size estimation, parallelism estimation, length estimation, dividing lines, two-dimensional size estimation, and speed and distance estimation. On the slide you see 2 examples. When estimating the position, 2 big fields are indicated on the screen. One field shows a fixed position as a reference, the other shows the same object in a different position. The task is to move the picture to the same position. The other picture: when estimating relations, vessels with a given amount of liquid have to be filled or emptied. The training works adaptively, while for each category a separate level sequence is defined. The task of each category will be explained to the patient in a tutorial. In case, the task will be started with the option Instructions. At the end of the tutorial, an easy task needs to be solved in order to start the actual training. Please note, each RehaCom module is equipped with a short tutorial, and they are translated into more than 25 languages. As valid for all attention functions, repetition and sufficient intensity of training is critical for re-establishing of automated attention skills. The next one is divided attention, also known as multitasking. Individuals do this all the time. Examples are singing along to a song while driving, having a conversation while walking, or listening to music while grocery shopping. 2 modules are part of the attention battery, an easier one for severe to moderate deficits called divided attention, and a more challenging one called divided attention 2 for milder deficits. When using the divided attention module, the patient works as the driver of a train who sits in the driver's cab of the train and has the following task. The patient must observe the control panel of the train and the countryside carefully, and react to different events as they occur. At first, only the acceleration of the train has to be changed. Later on, and with increasing levels of difficulty, more tasks are added. Different levels of attention and particular reactions are expected from the patient. In the module Divided Attention 2, clients have to pay attention to several external stimuli whilst driving a car. They have to observe the landscape passing in front of them as well as the car dashboard, and react to visual and acoustic information in a differentiated way. While handling different tasks, the client has to drive a certain distance in a limited time. The client has to react on traffic signs and traffic news, has to adjust the speed and has to stop if indicated. Besides reactions to relevant stimuli, the client has to inhibit distractors, for example, billboards on the street. All therapy results are stored automatically in the client's database. The record allows for database treatment. The therapist can evaluate and print results in overview or in detail. An easy result view explains the progress to the client, and a complex view allows the therapist to evaluate details.